Hi guys, this is Dr. Bhupesh from Dr. BKM Institutes. Today we are talking about bit of listening things, how to do listening because listening has emerged as one of the bigger challenges, and that might be because of the lack of the practice, that might be because of the spellings. So we will discuss about listening everything in detail. And first of all, you can pick any random listening. So what I normally do, I go to YouTube and I search out for any listening that comes my way. So today this is the listening that we can do together. So I'm just going to record it as well, and let's see who has created this listening so that we can be thankful to those people who have created it. So this says welcome to OET listening 2.0. So thanks who have created this question paper. So my job is to tell you how to execute it. So in the initial stages of the listening, you will get 1 to 12 questions. That would be in the one part. Then 13 to 24, that is the second part. And so it's like 1 to 24 question in which you have to fill in the blanks. And then after that, there would be multiple choice questions in the part B, part C. You will have two extracts. So part A is composed of fill in the blanks. Again, majorly it's about doing more of listenings in the part A to learn more of spelling mistakes, to learn more of spellings, lot of different words that they may utter. Accent can be one of the things that can be learned. You can repeat your listening at least 2 times to understand the accent, and then we will do part B and C. So first of all, I'm going to start from here. So in the listening part A, what happens? You will get some time, like around 90 seconds or something, or maybe around 60 seconds to read the question. So what I normally do, this is the best technique again. When you get the time in the start, this is where you utilize the time. The major thing is to utilize this time. So first of all, to understand what is the topic. So I will go through the topic in the first 60 seconds, whatever the time frame they give. So Greg Matthews, 72 years, symptoms and disease, fell down from the stairs unconscious, evaluated by a local clinic, was amnestic. Amnestic means kind of a memory loss, temporary memory loss. And that is why I say OET cannot be taught by the people who are not from the medical domain. Now, this is the word amnestic. When people do not understand, how would they actually help you to learn OET? So that is why I normally always say that people should belong to medical domain when they are actually helping you with OET. So that is where Dr. BKM comes handy. Being doctors, we can tell you about these words, but generally saying that you should understand the overall what this listening is all about. So I can understand a person fell down, was unconscious, amnestic on examination, referred by a local clinic upon viewing a GCT scan report, whatever this thing is, past medical history, atrial fibrillation dash with associated with left hemiparesis and dash. So when it comes to these kind of big spellings, because as we can understand atrial fibrillation, so if it is a common term, then the spelling should obviously be correct and you should try. But when it comes to drug names, when it comes to any particular disease name like Alzheimer's disease or any other Addison's disease, you can do the spelling wrong. So you can do the spelling wrong only in two things: name of the disease, if it is on a person's name, or a brand name of the drug, not paracetamol like Panadol, not amoxicillin but Augmentin. So these spellings can be wrong. So starting from there, so first thing I can understand, there would be past medical history means there should be a disease. Atrial fibrillation dash with associated left hemiparesis and dash. This was followed by a right coronary artery for 98% stenosis. However, the stroke symptoms signs were resolved. Dash total replacement of right knee. So dash total replacement should be like knee total replacement, but they have given the knee word here, so I don't know what to fit in. So I will try to guess at least 2 or 3 blanks which should be correct. Like medications, obviously these spellings can be wrong, so you don't have to worry. Family history: father expired of an dash at 70, and means like an acute disease. There should be something that is starting from A, E, I, O, U. There should be a vowel sound. So it is not necessary, but an word means there should be a kind of a vowel sound. So I will talk about this when this word will come. Then blood pressure, this is respiratory rate. It can be number of the respiratory rate. You might have to put the number. Then dash reflexes are symmetric bilaterally. Bilaterally means on both the sides. Like if it is on the left side, it is also on the right side. So these are the common things you should know, that what kind of listening have you got today. So what I have learned from this listening, I have got something that the person has fallen, then there is history, then there are medications, then there is family history, then there is diagnosis, and then impression. The impression mean kind of investigation maybe. Previous SCT scan reveals a word. Again, I always note the articles very carefully. And a. So these are very important words. And over here, the preposition of. So all these words become very important to be noted, like preposition of, all these words are very important. Now I will play the listening straight away. This is kind of the time you will.
1 to 12, complete the.
Let's see what is it. Is it difficult or easy? I will definitely let you know. So they are giving you some minutes, some seconds to
Now 20 steps
to read this task. So now you would have read this task. This is the best technique. So you need to understand what total listening is all about, and you need to put your ears focused when it comes to medical history, because this is the first question about medical history. So let's start it from here.
Problem? Well, doctor, he is Mr. Greg Matthews, my husband. Actually, he fell down yesterday morning when he was trying to put his boots on top of the staircase. He fell down 20 steps and he has lost his consciousness. He was evaluated by a local clinic and was amnestic at the time of examination. A HCT scan was taken and thereafter they referred to your hospital.
Well, what's his age?
72, doctor.
Does he drink or smoke?
No, doctor.
So as I can understand, there was no question about drink or smoke. So I need to avoid, means I can focus on other words. So focus is very important. It's about concentrating on that particular word which is important for you. In this case, otherwise, if there would be smoking 20 cigarettes a day, if there would have been a blank of smoking or alcohol, I would have concentrated. But that is what it gives you leverage, when you know what you want. So let's see other things.
Know his past medical history.
Well, he had.
So now my focus is double. This is the way to do listening. It's about utilizing your energy in the best of the channels. Let's utilize.
Atrial fibrillation, right hemisphere stroke last year with associated.
So right hemisphere stroke. It was a clear word. Right hemispheric stroke. That was the word. Again, I will repeat it for you just to make sure if anybody has.
CT scan was taken and thereafter they referred to your hospital.
Well, what's his age?
72, doctor.
Does he drink or smoke?
No, doctor.
May I know his past medical history?
Well, he had atrial fibrillation, right hemisphere stroke last year with associated.
Right hemisphere stroke. So this is my first blank. Last year are 2 extra words. If you write it, that's fine. If you do not write it, that's not a problem. In actual OET exam, you would be able to fill in 3 words. So you don't have to write last year. So you don't have to worry about this. But if you listen to it, and if it is not in the blanks, suppose if I get this in the final exam, which will not happen, but generally saying, if I get that, then I will write it. If I've heard the word last year, then I will write it. Otherwise, I won't bother. The main thing is atrial fibrillation. The second thing is this right hemispheric stroke. So that is my second concern. Let's see what are the other words.
Hemiparesis and amaurosis fugax. This was.
Now this is a word amaurosis fugax. Now this spelling can be wrong. You will still get the marks because this is something that is not a common spelling. Otherwise, examiner will not put this kind of a blank. In the final exam, you will not get this kind of a blank. If you get this kind of a blank, this spelling mistake would be allowed. So you don't have to worry about these things. That ogumanic, whatever ogumanic flexes. So if I write O-N-G or A-U-N-G-R-U-M-F-U-G-E-X, whatever the word I have heard, I will not bother about this thing. Why? Now this is the most important thing that I want to tell you all. If it is your final exam, that is what you need to realize, guys, that OET is a percentile method exam. Means if this blank, if they consider the spelling mistake, first of all, they will not consider the spelling mistake. Even if they consider the spelling mistake, then everybody would spell it wrong. Everybody would spell it wrong. So percentile method means this question becomes a kind of a question that is nil for everyone, because nobody would be able to execute this question except if a specialist working in this field can understand that word. So you don't have to worry about these things at all. You should not worry at all. That is the main thing you need to understand to stay motivated in the exam. Please don't worry about this blank. So this is missed by everyone. So Whatever you hear, just put it that blank. So don't worry about these kind of questions. Let's go to other
Followed by
questions.
a right coronary artery for 98% stenosis. However, the stroke symptoms and signs were resolved.
So now I lighted, I kind of took a deep breath in between just to make sure that I listen to this blank very carefully. So this is what is my main thing. So one resolved, she has spoken up to one resolved. Now again, I start focusing. So basically the main thing is to save energy when it is not required, but keep an eye on. Don't miss out on the questions. Keep an eye on. Now you focus again.
Degenerative joint disease, total replacement of.
Now this is accent problem that you might face. She has spoken it very badly. Degenerative joint disease. Again, she has spoken in a very bad way. This is very hard to hear, but I have a lot of practice of listening because I have stayed in New Zealand, I have stayed in UK. So I understand these accents, but if you will listen to it carefully, you would be able to execute. Let's listen to it again.
Doctor.
May I know his past medical history?
Well, he had atrial fibrillation for 98% stenosis. However, the stroke symptoms and signs were resolved. Degenerative joint disease, total replacement of.
It's very hard to say. Even if you listen to the word joint, then write joint. If you do not understand the word degenerative, the way she has spoken, it is not your fault. But obviously, if you will practice more, you would be able to adopt that. But again, even if you listen to joint word, at least write the word joint. So that is the main thing. But if you have understood the word degenerative, then do write it. If you do not understand, again, this is not your problem because this she has spoken it this way that it is hard for everybody. So again, otherwise this will blank will become nil or you will get the marks. But you should practice this kind of accent. Let's listen to it again.
This was followed by a right coronary artery.
Sorry.
Does he drink or smoke?
No, doctor. 8% stenosis. However, the stroke symptoms and signs were resolved. Degenerative joint disease, total replacement.
Was hard to, but joint is the word that I could listen to very easily. So let's go to other blanks. Let's see how.
And a right knee 2 years ago.
So now you have time to relax again. So by the time they talk about medication, then you again put your energy in. Till the time you can think about this blank and you can think about other questions. So yeah.
Venous stasis with no history of deep vein thrombosis.
What medications is he taking?
Lasix 40 milligrams once in a day. Zantac 150 milligrams.
Now Zentech spelling can be wrong. Zentech is a common, again, that is why I'm saying now OET can only be taught by medical professionals. Zentech, I have been listening since my childhood. Zentech is kind of, I don't know whether it is the same Zentech, but ZANTAC. Zentech has mostly the salt of ranitidine, I guess, but I'm not 100% sure. But yeah, so I have heard this word Zentech a lot. ZANTAC, but again, you can spell it wrong. So when it comes to OET listening, obviously different, I don't know, again, to whom this listening belongs, but again, that person might not be from medical professional. He might have the PDF of this thing, but again, you can do spelling wrong of the brand name. So there is nothing to worry. Even if you read ZINTAC, ZANTJINTAC, that's fine. Nothing to worry about it. So you can do brand name spellings wrong. So please do not, get demotivated for these things. Let's listen to the next blank.
A day. Flanoxin 0.125 milligrams once daily. Capotin 2.5 milligrams twice a day. Salicylate 700.
Salicylate. Salicylate again is kind of a chemistry word I have heard in the, during during this pre-medical examinations, pre-medical preparation, also maybe in the dentistry. Salicylate, SALICYLAT. Again, this is the brand name. This is a salt name as well as, it can be a brand name, but I will try my level best to spell it right. But if I do not worry about this thing. So salicylate is the word that she has spoken. I would again repeat it for you.
Lasix 40 milligrams once in a day. Zantac 150 milligrams once in a day.
So Zantac, if you can listen 150 milligrams a day, so you can write that thing. But again, in OET, you will not find 3-4 words to fit in. You would have to write 2 to 3 words. So even if you write Zantac, then you will still get the marks. But if it is talking about if you listen to it 1.25, then please write it down, 1.525 milligrams per day. So that was the word that was spoken. So you try to listen to as much as you can. Listening material is all about practicing. You can practice it from any YouTube video, but don't take over stress when you do not know the spelling of the brand name, or when you do not know the spelling of the disease name like Addison's, Crohn's. Obviously, diabetes mellitus have to be right, and hypertension has to be right. Myocardial infarction has to be right. But Addison's, Crohn's, these spellings can be wrong. So in this case, even if I say the spelling of Zentech, that is not a problem. Again, do not stress yourself. Do not burst yourself out. Let's go to next question.
Noxin, 0.125 milligrams once daily. Capotin, 2.5 milligrams twice a day. Salicylate, 750.
Salicylate, again, you say salicylate, or you say, what I have heard is salicylate is the word I have ever heard. But again, if it is a brand name of the medication, I will still get marks of salicylate, SALICYLATE. So that is what I will write. Let's see. Let's see.
Milligrams thrice a day. ASA, 325 milligrams once in a day. Ginsana, 100.
Ginsona. Now you can write JINSONA, or you can write GYNSONA. Both will be correct. So please, again, the main thing is that we take unnecessary stress. So it is allowed in OET to spell brand names wrong, disease names, again, on the name of some person, only then. Otherwise, diabetes has to be correct and all those things. Yeah.
100 milligrams twice a day.
Is he allergic to any medicine?
No, doctor.
May I know his family history of illness?
Well, his father expired of a myocardial infarction at.
Now, this is what medical knowledge is all about. This is what is the knowledge of medical OET, occupational English test. Your medical knowledge, occupational, and then that myocardial infarction. Why an word is an important word to consider as an article. So anything like I have to write an, but myocardial infarction word is again not fitting in. So I will listen to this word again. An word should go with some vowel sound. So I will try to execute it again, but they are saying myocardial infarction, I guess. Let's see.
ASA, 325 milligrams once in a day. Ginsana, 100 milligrams twice a day.
Is he allergic to any medicine?
No, doctor.
May I know his family history of illness?
Well, his father expired of a myocardial infarction at 7.
So basically, they have given it wrong. This word should be a. This word should not be an. Again, that is what I'm saying. Do not trust listening material too much. You practice it, you enjoy it, but don't take stress. This an word doesn't go with myocardial infarction, because myocardial means start with m. So it is, the sound is myo. So this word does not go with an. The word that goes with an is acute myocardial infarction. So this an is wrong over here. If they had to write an word, then there should have been word like acute, an acute myocardial infarction. So if that word is not given, so this word should not have been an. This is wrongly given over here. So when you practice, sometimes you take unnecessary stress and then you do it wrong. You should not do yourself wrong. So myocardial infarction does not start with vowel sound. An acute myocardial infarction, but they did not say word acute. So this should have been a rather than an. So these are the small things that gives you stress. But again, listening, just practice it. Don't worry about the spelling like Gintech. That is why maybe you told me to do this listening. But please don't take stress of these things. Please. Let's go further.
And his mother died of complications of a dental procedure.
Well, his physical examination reports show blood pressure 157/86, heart rate and irregular respiratory rate 12 to 20 breaths per minute.
Heart rate and respiratory rate. So I can at least fit heart rate for sure. So heart rate word should be here, and numbers, even I could not trace it for the first time. Let's see what it is.
No, doctor.
May I know his family history of illness?
Well, his father expired of a myocardial infarction at 70, and his mother died of complications of a dental procedure.
Well, his physical examination reports show blood pressure 157/86, heart rate and
Heart rate. Heart rate is the word that I got in the first time.
respiratory rate 12 to 20 breaths per minute.
12 to 20 dash per minute respiratory rate. I don't know how to say this thing, but 12 to 20 reps per or repetitions, reps. Oh, this word again. Reps means repetitions. REPS, reps per minute. So when I try to, think inside my head, what can be this word? So reps means like in the gym, when we go to gym, say they say do 12 reps, 12 time repeat. So this word I have learned from gym. So do 10 reps, do 8 reps. So they are saying maybe the reps. I hope we will check the answer at the end, but let's see. But respiratory, he said 12 to 20 reps per minute. I'm 100% sure that should be the word, but let's see the answer later on.
Reflexes are symmetric. Plantar responses were flexor, bilateral.
Sorry, he was about to say that plantonic reflexes I could not really notice again.
Reflexes are symmetric. Plantar responses were flexor, bilaterally.
Now this is an impossible blank to fill unless if you know this word by chance you are working in this particular sector, means in particular cardiac department or something, then you know it. Otherwise you will miss this word. So you don't have to, again, then it becomes a nil blank for everyone because nobody is able to fill except specialist in this particular field. So you don't have to, degrade yourself or depreciate yourself. Please try to motivate yourself for the right things. So again, in the exam, you will not have this kind of a difficult listening. If that comes as this part of difficult listening, then obviously you have the margins of spellings, which can be done wrong. You will still get the marks. And when it comes to these things, these blanks, like this was given as wrong. And when it comes to these, it will not be that fast. So the words would be clear, but something it said plantoric, something. So I don't know about it. So I will admit it. Let's see the next one.
Vascular regular rate and rhythm without murmur. HEENT shows abrasion over the right forehead. Extremity, distal right leg edema and erythema just above the ankle. Well, I have reviewed his previous HCT scan, which reveals a left.
So now I thought that I missed out on the 11th and 12th blank, but that was a pause to take a deep breath again, because now he is talking about that HCT scan. So now I will start focusing again. So
The ankle. Well, I have reviewed his previous HCT scan, which reveals a left parietal epidural hematoma.
Left pyroidal something. Again, I'm telling you, these kind of blanks will not come in the final exam. You don't have to worry about these things. Obviously, this listening is difficult.
Right lower extremity revealed a fracture of the right lateral malleolus, for which he was casted.
Right. Whatever thing, malleolus, something words he has spoken. So again, I have got your point that you basically were kind of got anxious because of the words he has spoken, and when you would have checked the spellings of this would have been this would have been wrong, so it would have stressed you out. But again, just take the listenings, and whatever you can learn from these listenings to learn more spellings is good. But in the final exam, you can't have all the blanks difficult. It can be maximum of 1 or 2 blanks of this kind in the part A. So you don't have to please stress yourself. So again, to revise, atrial fibrillation, there was a word that we fit in, was pretty clear. This was not sure, organophobus, whatever the word was. This was sure that degenerative joint disease. This was sure it was Gentech. This was sure it was salicylate. This was, I'm not quite sure whatever this thing was, I forgot. Father expired because of myocardial infarction. This should be clear to me. Heart rate should be clear to me. Then reps per minute, 12 to 20 reps per minute should be clear to me. This I did not get, this I did not get, and this was not very good plan. So you do not get this kind of exam, obviously. But if you are by chance doing this kind of a listening, then please try to learn as maximum spellings to secure yourself. It's about securing yourself. But again, please don't get worried about these kind of listening practice materials, but try to learn more spellings. But you can't have all the blanks difficult. If all blanks are difficult like this, then every nurse would have a problem. If every nurse would have a problem, then obviously the cutoff will go low. In OET, there is no certainty that only 32, the person scoring 32 will pass. It is not a certainty. Even 28 wala can pass if it is too difficult listening. So this phenomena, this particular thing is very important for you to know and to understand while executing your exam. Even if you can do 10 good blanks, 8 good blanks, do your best, because today cutoff might go to 26. So please do not lose your heart. Means you don't have to, kind of become anxious. Just do whatever you can in the best possible way and try to secure as much marks, because there are many people who will drop the pen like this because they would be disheartened. So you have more chances to pass because of the competition. The cutoff has gone much below. So the cutoff has gone much below because of the competition. So please understand. And because of the anxiety, the people who could have done at least 2 or 3 blanks, they will not do 2 or 3 blanks even. So that means you will have more chances to pass even if you do it all right. So if you are missing out on the spelling of the brand names, don't worry. Disease names, don't worry. Just write whatever you can. You might get marks for that if the pronunciation goes same. So that is the main thing that you need to understand in OET listening. So this is Dr. Bhupesh from Dr. BKM Institute. Now I would like to clarify doubts from rest of the people who are attending the class at the moment, and let's see what they have opinion of, so that maybe the YouTubers who are following us can also have a bit of idea. Any questions, guys, that you would like to ask in this? Obviously, you would have a lot of questions, but any question that makes you feel anxious about this listening, you can ask me. Please, any question. Any question, please? None? All good? Anybody here?
Sir, we have very less time to fill in the blanks
So
with
you
the
are,
correct.
please
Sir,
repeat.
okay. Sir, we don't have proper time to fill in the blanks properly with the accurate spelling.
Ma'am, again, I'm telling you, when it comes to that normal spellings, it has to be correct. There is no doubt about it. There is no doubt about it. There is no doubt about it. Spelling has to be correct. You have to increase your speed. But ma'am, if you will realize, ma'am, then there are always, if you will understand, there is always a margin, my dear. When you are doing this 2 blanks, they are speaking this 1 line extra. Then when you have this blank, then they are speaking this extra. When you fill in these 3 blanks, you will get the margin. There would be 2 3 lines that would be extra spoken. Then there would be this blank. So you will have enough margin for sure. This was fast listening. Obviously, I understand this kind of a listening cannot come in the final exam, because then the cutoff will reach even to 25. So again, to tell you, if something like this comes in exam, then please understand part B and part C will come very easy. So stay positive till the end. As I am telling you, it is all about securing marks as compared to others. OET is a competitive test. It's not like IELTS that you have to score 30 only. You might score 25 and still you will pass. So if it is too fast, then everybody will miss it. So the main thing that I want to teach here over in the OET listening part A is to stay positive till the time you have that margins. Maybe that one number can take you to 350, 360. Maybe that one number can take you to 400. Maybe that one number can take you to 450. So it's about creating those margins. So I understand it is fast sometimes, but it cannot be super fast. If it is super fast, then it is for everyone and the cutoff will come down. Did I answer you, ma'am? Let's read the chat box. A plantar reflex. Yes, I could have done that plantar reflex, because plantoric or something that he said, but it was a hard word too. And then that Pujarana ma'am says it's breaths. Breaths word can be there, obviously respiratory and breath, 10, 12 to 20 breaths. That can be the answer. That I can commit as my mistake. So if I heard the word reps, but the way it was spoken, it was very hard. So malleus, malleolar, being a dentist, I have not been through these words, and OET would be the same for nursing doctors. So they cannot make these kind of difficult words to come in the exam. And then Navneet ma'am says, I have problem in difficult terminology when it comes. Ma'am, terminology, you will get the marks for terminology. Don't worry about it. Again, I'm telling you, you will fetch the marks, whatever you write. Sir, can we write myocardial infarction there? Obviously, that is the only word you have to write, myocardial infarction. Can we get marks for it? For if I forget to write articles? No, you do not lose the marks in OET if you forget the articles. But I am telling you to notice these articles to make your blanks better, to understand where the answer can be. So when any word is spoken after A, I become more focused. So that is what I am teaching, that at articles you become more cautious. Otherwise, you don't have to write the article in OET, you will not have any mark deduction if you have not written articles. So you don't have to worry about that thing. Any other question, please, that you would like to ask? I'm recording it as well. Don't worry if I am speaking fast, even it is getting into the recording as well. You don't have to worry. Any other question, please? If one blank it's vaccinated, but I wrote vaccination. Ma'am, vaccinated again, that comes, then it is a grammatical mistake, ma'am. If somebody says vaccinated, if I say he is vaccinated, if I write he is vaccination, then obviously it is wrong. It is a grammatical mistake. They will deduct marks. So it depends upon what the blank is. Suppose he has come here for vaccination. So I cannot write he has come here for vaccinated. It would be wrong. So you have to fill the blank according to the grammatical demand. So that grammatical demand says he is vaccinated and he has come here for the vaccination. So obviously this word you have to change according to what the demand of question is. Any other question, please? Any other question, please, guys? Anything you can ask again. So in listening, again, it is a test of margins. Again, I'm telling you, if the paper comes difficult, then trust me, this is the paper. If you have studied from Dr. BKM, this is the paper to pass, because you know that today cutoff will go down. There are many average people who will not do up to their potential. So this is the time that I can easily pass, because others would be disheartened and some would be heartbroken. And if you can persist in that bad time and can try your best, you will pass. So we have to think how to create that margins to pass. Sir, sometimes it is written that heart rate in question, and we write heart rate with number. Is it right or wrong, ma'am? If you are writing anything extra, suppose if they in the start they will say don't write more than 3 words. So if they say don't write more than 3 words, and if it comes heart rate 92 per minute, then you will not have deduction of marks. But if you are say increased heart rate leading to this thing, so if my blank is of 3 words, I will say increased heart rate leading to, I won't care. So I will write and number. If you have listened to it nicely, only then write it. And again, I'm telling you, ma'am, in the practical, in the real OET exam, obviously they will not expect to write everything. The blank will not be of such kind where you would have to write heart rate as well as the number. So either they will mention the word heart rate, you might have to write the number only, or they will mention the number and you might have to fill in the word heart rate. So you don't have to again go with this kind of anxiety. So just again do it easy. If it would be number, you say heart rate, and if it is given heart rate, then you will have to put the number. It cannot be a big blank saying heart rate noticed to be this much. This does not happen in OET. Earlier it used to happen before 2019 when 2.0 was not there. Now it is OET listening 2.0, which says that you have to just mention 2 to 3 words. That's it. And when listening used to be of that kind in the past times, then spelling mistakes were not the problem. Then writing a big line, grammar mistake was not the problem. So it's according to what I want to say again. It's according to average people that they create exam. Even any exam creator wants you to pass, but sometimes we fail just because we get anxious and we feel like heartbroken, and we do not do the easy ones. Again, I have told you the major fundamental of reading and listening, that if you can do all the easy questions right, you will pass. 100% you will pass. The problem is that even if you do your practice, you know that some easy questions in the reading, some easy question in the listenings, we make wrong. That is where we lose marks. So if you can do only easy questions right, and don't worry about the difficult questions, but you fill in something, then you have high margins to pass easily. So focus on this, that easy question should not be wrong and the difficult questions should try to be right. So you try to do the best you can, because again 350 is the target, but who doesn't want 400? Who doesn't want 450? Everybody wants it. So it's just about those things. So try that easy question should not be wrong and difficult. If you can listen something, if you can write something, write it, because you don't have negative marking in OET. So you have to do that.
So like in fill in the blanks, if we get a long sentence like right epidural hematoma. So instead of writing full RIHT, can we write RT? Will be given full marks for that.
Epidural hematoma is not the kind of the word that can be written in E and H. Obviously, it's not right. There are certain things like if I say, what should I say? Like blood pressure. If I write that BP, it is common accepted medical terminology. Then they will give you marks for BP, for blood pressure. But if they say diabetes mellitus, I would still encourage write it completely. Hypertension, write it completely. Alzheimer's disease, write it completely. Even if Alzheimer's spelling is wrong, they will still give you marks. But though epidural hematoma is kind of a word they would be expecting spelling. Epidural hematoma. So epi, D-U-R-L, E-P-I-D-U-R-A-L, hematoma. And that is what I call Hematoma. So hematoma. So again, so these spellings, if you can do right, obviously that is much better. And you should know the spellings. So that is why you practice listenings, na? To learn the spellings of hematoma. Hematoma is a common word in medical thing. So if you do like 30 listenings, even hematoma word will definitely come. So you should know this spelling. So don't you should not write E and H epidural. You have to write epidural hematoma. You have to write it completely.
Sir, I'm asking for left or right.
Sorry?
Like for right, we have to write proper RIHT, or we can use the abbreviation RT.
Isha ma'am, right word, it doesn't take even, what should I say? It doesn't take even second to write. Right. Or even if
If
you write
we have to write
what I'm saying,
along with that, like epidural also we have to write, hematoma we also have to write, like in yesterday's listening.
you should write complete.
Okay.
Ah. Because right word is again you say R dot epidural hematoma. Dot also will take the same energy as will take RIGHT. Trust me, I'm telling you. So these spellings we will not make the shortcuts. No.
Okay, sir.
It can be there, Nisha, that right word can be put in the final answer that examiner will get. Right will be might be in the bracket, and epidural hematoma would be the main word. So that means examiner can give you marks even if you have written right, even if you have written R. But when it comes to teaching you, for these words, I would encourage to write complete. Means my job being a responsible mentor is to make it short that you should pass. So in that case, I will tell you that you should write RIGST. But in the examiner will have 2-3 margins. So even if the right would be in the bracket, somebody will not write it, still might get marks. But I am here to teach you that if this kind of a simple thing can be done right and you have listened to it, then why not write it? So these are the easy pickings, and we should not be slow in writing. We have to improve speed. We will work on it. These are this is what I say. When you say Zentech, I don't know the spelling. This is uncontrollable thing. It is not in my power. But when it has to be written right, RIGST, this is a controllable thing. This is human endeavor and I can control it. So I would not like to miss even a single marks just because I I told myself that I am slow. I will try to improve because this is a controllable thing. So I would encourage you to write it.
Okay,
Does it make sense, ma'am?
yes, sir.
But I want to say it is a controllable thing, and I don't want to risk my even my 1 mark because I might get, I don't know what to say, but some people get 340. I might get 340, and if that is because of this, right, why would I miss it? This is a controllable thing. I would write it. I would improve my speed. I will work hard on it. I will do anything, whatever it takes. but I won't let any controllable factor go out of my marks or out of my reach. If something is uncontrollable, like malleolus, so that is not a common word of medical thing. So that is uncontrollable. I do not take anxiety for being for uncontrollable things, but for controllable, I try my level best. It should be a habit. I hope you understood my point.
Yes, sir.
Got you, sir.
Like that is what I'm saying. Controlling anxiety is a controllable thing. Sometimes we do get, but take a deep breath immediately and then come back to business. Even if it is a difficult blanks, like 1, 2, 3 blanks are difficult, that doesn't mean I should start believing that my exam is difficult. Obviously, the thought will come in mind, but I will tell myself, no, buddy, I have to pass. I have invested a lot, and I did not invest for this day where I lose marks because I broke my heart. I can control my heart for 3, 4 hours, then I will broke my heart later on. I have time to break my heart till the time result will come. But if I will do everything right, if I do everything possible, I will pass. Or it is not a difficult exam. If you do all the easy questions right, you will pass. I'm telling you again, as a part of my experience, when we do easy things wrong, that is where we fail. People do not fail because of difficult questions, because difficult question is done wrong by everyone. We fail because we did not do easy things right. Right? Does it make sense?
Yes, sir.
Everyone, please. Yaar, I'm giving so much of energy. Yaar. Give me something back. At least your yes or no.
Yes.
Yes,
Yes,
sir.
sir.
Yes,
Yes.
sir.
Thank
Yes, sir.
Yes, sir.
That makes me breathe easy, right? I also get anxious when you do not reply, but then I keep on teaching. Now it is a controllable thing. Even if you don't reply, I will still give my best because it is something that I can control in my teaching part. If you, even if you don't respond, I have to do my lecture in the best possible way. If somebody tries to understand it, if somebody is sleeping at this time, if somebody is switching on the video and is still sleeping, it is beyond my control. So earlier I used to get angry when I was immature, but now I am a mature person, and you will also become mature, and I need to teach the maturity that things which are not in your control, do not worry about them. The things which are in your control, do not leave any stone unturned. Do your best. Do your best. Write fast. Practice more. And again, write very neatly in the listening. Develop a practice to write neatly. To all the doctors, especially, nurses also sometimes are very fast. They do not write it nicely and clear. But doctors, especially, we are in a habit of it. So please write it very neatly to get marks. So I'm ending the lecture here for the recording part, and then I will take more of your questions. Thank you very much for being a patient hearer or a listener. If you are a listener, that is a good thing for me. Thank you very much.